Hi, Mr. John Doe. My name is Clayton Oakes. I'm a nurse practitioner student working with Ms. Pam this semester. Was told you had some questions about your diabetes and that you would like to get off some of your medicines through like diet and exercise. So I'm going to go over a few things with you, some health maintenance and health promotion for diabetes type 2. These tips will help guide you on the journey to transition off these meds and to a healthier lifestyle. A few of the topics that I'm going to go over with you are, we're just going to talk about what diabetes type 2 is, we're going to the proper diet for diabetic patients, and then how being active can help patients with diabetes type 2. I do have a few handouts for you from the CDC and from CardioSmart, and we're going to go those together, okay? What is diabetes type 2? According to CardioSmart at the American College of Cardiology, it is a condition in which your body cannot properly process sugar. So it does this by either failing to use the insulin that you already have in your body, or that the pancreas fails to make enough of that insulin. This can cause your sugar to get high because the body is unable to use the insulin correctly to process it. Did you know that about 30 million adults in the U.S. have diabetes? So you're not alone, and about 1 in 4 actually have it but don't even know it. If diabetes is left untreated, it can affect multiple body systems. It can affect the nervous system, the eyes, your teeth and gums, your coronary arteries, kidneys, blood vessels, and even your feet and skin. Uncontrolled high blood pressure from diabetes can lead to increased risk of heart disease and stroke. It can even threaten your vision, limbs, and extremities. But luckily, this disease is treatable and reversible through medicines, but also through proper lifestyle changes like you're talking about, diet and exercise. So we'll go over diet and we'll go over exercise and how you can utilize that to help this process. Do you have any questions so far? No questions, okay. All right, let's go to the next one. All right, so here's a handout from the CDC. When we talk about healthy diet, there's a lot of people that have the healthiest one out there, so it's confusing to know which one to try, right? You got keto, you got carnivore, you got paleo, all these things. Well, for diabetics, healthy eating means eating nutritious foods in amounts that lead to better health and wellness. Your diet strongly influences your blood sugar and has a huge impact on managing diabetes. I'm sure you're already aware of that. Some foods that you should include in your diet are non-starchy, colorful veggies like leafy greens, carrots, and broccoli. You should focus on lean proteins like fish, chicken, turkey, eggs, beans, nuts, and maybe even tofu if that's what you want to do. Now, fruits may scare you. They do have, sugar, and that's scary for some diabetics, but don't let them keep that from eating them. You can eat fruits like apples, oranges, and berries in moderation, and you'll be fine. Finally, you want to ensure that you eat small amounts of healthy fats like olive oil and avocado. This will give you a well-rounded diet that should help you manage your diabetes along with losing weight. Some foods you should stay away from like processed carbs, fast foods, sugary snacks, sugary drinks, and candies. These are going to spike your blood sugar and make it really hard to control it, even with your medicine sometimes. Do you have any questions about this pamphlet? No? Okay. All right, so being active. While diet plays a huge role in both weight loss and diabetic management, a key contributor is exercising. Exercising and being active can help lower your blood sugar, help you lose weight, boost muscle strength and heart health, lower your blood pressure and cholesterol, help your body's insulin work better, enhance your mood, and add years to your life. It can do a lot for you. It's very, very good for you. Now, when I say exercise and being active, I just mean keeping your body moving. You don't have to go to the gym for hours and hours and hours. You don't have to be a bodybuilder or a CrossFit athlete, unless it's what you want to do, but you just have to have your body moving. You can take a walk, you can ride a bike, you can swim, you can just go outside and do yard work, or whatever you need to do just to get you moving. The goal, though, is to take it slow when you add exercise in, especially if you haven't done it in a long time. You already are a very active man, like we talked about earlier. You worked at Procter & Gamble, and you're on your feet all day and you do a lot of walking. So, ease in as much as you need to feel comfortable. maybe just like a walk after work or a light gym session before you go in, whatever works best for you. The overall goal though is to have up to 150 minutes per week of exercise or being active. That usually comes out to around 30 minutes a day for 5 days. But between the exercise and the diet stuff we just went over, that's a good place to start to obtain your goals that you have listed. The goals that we talked about include this diet and exercise routine in your daily life. Should have you on your way to a healthier life. It's going to be a little bit of a change, but keep it up and don't be afraid to come back in or give us a call if you have any more questions. If you need help with your diet, we can always refer you to a dietitian as well. And if you need some help with getting started in the gym, most gyms have some personal trainers that can help you get started. So good luck on that. And if you have any questions about anything, please don't hesitate to call or come back in. We'll be glad to help you out.